Health experts blame numerous causes for the high price of medical care. One cause of the high cost, too many hospital beds. But more and more hospitals are being built and others expanded, further driving up the cost to you. Why have so many hospitals set up shop in Louisiana with the blessings of some top political leaders? Here at federal court, that question has aroused the curiosity of FBI agents and the U.S. Attorney. A federal grand jury has been looking at it for the past 4 months. The investigation leads all the way to Governor Edwards. At the heart of the controversy lies this document called a Certificate of Need. It is worth millions of dollars to anyone who can get one. To qualify for the Certificate of Need, the developers of a proposed new hospital or nursing home must meet guidelines set up under Section 1122 of the National Social Security Act. Developer John Liljeburg got his certificate for the new St. Jude's Hospital, now under construction in Kenner. But it cost Liljeburg a $1 million court battle with competing businessmen.
Bottom line, dollars, money, greed. There's no two ways about it. And the only way they'll get my 1122 from me is to pry it from my dead, cold, stiff fingers.
Why is the Certificate of Need so important? Because when the state grants these certificates, it is in effect saying that the community in question needs the proposed hospital or nursing home. And once that need is officially established, government money to help pay for the building is not far behind. Under the Social Security Act, the federal and state governments send money to the hospital owner in the form of capital reimbursements over a period of years. The size of those government payments is based on the percentage of poor and elderly patients who are covered by Medicaid or Medicare insurance. The owner pays for the remaining cost of construction with money from private sources. As an example, if you build a hospital for $30 million, the law will allow you to reclaim or depreciate the property value over 30 years. If, for instance, half of your patients receive Medicaid or Medicare payments, then the government would agree to send you $500,000 every year for the next 30 years. But the taxpayers' money will come only if your project has obtained the Certificate of Need. If you don't have the certificate, you can still build your hospital in Louisiana, but the government reimbursements will not be there to help you pay for it.
In my interpretation, in many cases, it would mean the difference between survival and failure, of a major institution.
To determine whether a proposed hospital or nursing home gets a Certificate of Need, researchers wrote this rule book, and they called it the State Health Plan. The rules divide the state into districts, and according to the plan, each district should have about 4 hospital beds for each 1,000 people, and for the most part, the hospital should stay 80% full. Yet, statewide, the occupancy rates in Louisiana hospitals have dropped below 60%, and some critics say the overabundance of beds has driven up the price for health care. Yet, some businessmen have found a way around the state health plan to get certificates of need, and they aren't even interested in building a hospital or nursing home. To them, the Certificate of Need is a hot commodity that, once obtained, can be sold for profit. Tomorrow, you'll meet some of those businessmen and see why the grand jury is so interested in their relationship to the governor. Taylor Henry, Channel 4 Eyewitness News.